Honourable Speaker, I thank the Honourable Member for that question. Honourable Speaker, we started with our COVID-19 vaccination program on the 10th of March, where we started first with our frontliners, and then since then, we did initially 7,217 individuals from the first batch of vaccines. Honourable Speaker, every vaccine that comes through in terms of the vial, the minimum that can be given from a vial is about 10. And usually when they come, there's about the nurses, because they give more than 10, usually up to 10 or 12 or 13 doses can be provided from that vial. And so therefore the initial 6,000, we were able to safely and hygienically give 7,000 vaccines. This was followed by another 100,000 by the Indian government, which we are grateful for, and for doses 1 and 2, 50,000 vials were put across aside, and also 50,000 were set aside for the second doses. This was followed by another 24,000 through COVAX and 120,000 from Australia with AstraZeneca vaccines. At this juncture, Honourable Speaker, it's important to also note that since we've started with our vaccination till now, we've been using only one type of vaccine, which is the AstraZeneca or the AstraZeneca Covishield, which is the one produced by Serum Institute in India. We know to date, Honourable Speaker, and we are thankful for the Honourable Prime Minister in his discussions with the Honourable Prime Minister of Australia, that Australia has now committed 1 million doses, of which 120,000 have arrived, and we are looking towards having the rest of the doses come through by the third quarter of this year, and 500,000 doses also committed by the government of New Zealand through the discussions that the Honourable Prime Minister has had also with the Honourable Prime Minister of New Zealand. The COVAX vaccines continue to arrive, and although they have been delayed according to the schedule, this has been boosted by the arrival of vaccines that are coming through Abu Valley in Australia, and also New Zealand, and 100,000 that came through from India. Our initial strategy, Honourable Speaker, before this outbreak has been changed, because we are now targeting the containment areas and have re-strategized our vaccination program with going closer to the communities. In this, we are using the buses that are available within government services that we have, including, we're thankful to the ministries such as the Ministry of Women and our ministry, and also using some of the FEMAT and also the discipline forces ability to set up tents. We're also trying to make sure that wherever we are closer to our people, that these are the places that can also be people-friendly in terms of making sure that we look after the elderly and having restrooms available on the sites. Honourable Speaker, we have managed to vaccinate 28,954 with first doses for people living in the Greater Suva to Nosori corridor, and a total of 33,077 outside of the Suva Nosori corridor. And as of 29th of May 2021, 136,247 people had received their first dose of COVID-19 vaccine. And Honourable Speaker, this is 21% of the Ministry of Health Services targeted population, estimated initially at 650,000 individuals, and a total of 3,808 individuals are now fully immunized after receiving their second dose. Honourable Speaker, as we continue to get the regular supply of vaccines from Australia and New Zealand, we anticipate completing the first dose of vaccination by July or August, with the second dose hopefully finishing by November. Our teams on the ground are split into different directions, one towards the COVID-19 containment and the fever clinics and mass screening, while the other is also doing the vaccination. Honourable Speaker, it is very important that, again stressed, that all Fijians that have not been vaccinated to be vaccinated, to look at the notifications that come through the Fiji government websites, Fiji government Facebook page, and also the Ministry of Health Facebook page, and also in the media. But more importantly, to be registered before you come for vaccination. This is so important. The registration is so important before the vaccination, because then we can do away with the queues that we have in place. Honourable Speaker, also last week we had news to hand that because of the registration that we have done and the proper detailing of the zones and the medical areas that we have in place, that the initial 650,000 that we have could be lower, it could be more towards 600,000 than 650,000. But despite that, we have made sure that we are looking at being able to achieve the target that has to be achieved, including if it has to be more than 600,000 or 650,000. I thank you, Honourable Speaker.